Cut.
Yeah, okay.
So come closer.
Little more closer. Yes. Little more closer. That's it. We'll go close. That's it.
Hey, wait.
Wait.
I express my warm welcome to Mr. Agarwals. It also has cataract, glaucoma, retina, cornea, pediatric services. All those services are also happening parallelly along with refractive service. So this branch, it doesn't, not even apart from the advanced equipment, it also has an excellent team of doctors headed by our medical director, Dr. Archana, who is an experienced surgeon who can handle both cataract as well as refractive surgeries, and Dr. Sanjana, who is the refractive head. SMILE is the advanced refractive equipment, which is a minimally invasive procedure.
Started our hospital 65 years old, and today we are already 113 hospitals strong, and we are growing. We are growing very quickly, and in 2 to 3 years we expect to be close to 200 hospitals. We also have started our vision centers, which is really an outreach to go to far and distant places where hospitals may not be available. We've already started that journey, and very soon in 2 to 3 years we should be 500 vision centers as well. We call that our 2020 centers. So that which is the perfect vision is what we are achieving for, and hence we'll be looking at 500 vision centers there as well. Coming specifically to Karnataka, we already have 15 hospitals in Karnataka, 11 in Bangalore itself. Of course, this is one of our prime centers. We have 10 more hospitals apart from Indiranagar branch as well, and in rest of Karnataka we also have another 4 branches, 4 hospitals, 2 in Mysore, 1 in Hubli and 1 in Agarwals. We won't stop here. Our investments in Karnataka will continue. In fact, as we are speaking, we are also looking at another 3 launches very quickly. We are looking at coming in another one in Davangere. We are looking at Tumkur, and we are also looking at Bangalore. And we are already simultaneously talking of a couple of more centers in Bangalore. In the next 2 to 3 years, we should be able to get to somewhere around 25 to 30 hospitals in Karnataka itself. Our overall investment that we'll be looking at in Karnataka over the next couple of years would be close to 100 crores. That is the way we are looking at coming into Karnataka. We have a lot of commitment into Karnataka. We are really thankful to the government, the way they've supported us in this journey, in this very, very long journey, in able to better patient care, in able to get better technologies. Today is an example of the technology that we are bringing in. Of course, our
ಇಂದಿರಾನಗರ ಶಾಖೆಯ ವಿಶೇಷತೆ ಏನೆಂದರೆ ಇಲ್ಲಿ ಎಲ್ಲ ವಯಸ್ಸಿನ ರೋಗಿಗಳಿಗೂ ಕಣ್ಣಿನ ತೊಂದರೆಗೆ ಬೇಕಾದಂತಹ ಎಲ್ಲ ಆಧುನಿಕ ಉಪಕರಣಗಳು ಹಾಗೂ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗೆ ಬೇಕಾದಂತಹ ಯಂತ್ರಗಳು ಇಲ್ಲಿ ಅವೈಲಬ್ಯವಿದೆ. ಮಕ್ಕಳಿಗೆ ಬೇಕಾದಂತಹ ಚಿಕಿತ್ಸೆ, ಮಧ್ಯವಯಸ್ಕರಿಗೆ ನಾರ್ಮಲಿ ಬೇಕಾಗಿರೋದು ಕನ್ನಡಕ ತೆಗಿಲಿಕ್ಕೆ ಇರುವಂತಹ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ, ಹಾಗೂ ವಯೋವೃದ್ಧರಿಗೆ ಸಾಮಾನ್ಯವಾಗಿ ನಾವು ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ಮಾಡುವುದು ಕಣ್ಣಿನ ಪೊರೆ ತೆಗೆದು ಲೆನ್ಸ್ ಹಾಕುವುದು. ಆ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗೆ ಬೇಕಾದಂತಹ ಆಧುನಿಕ ಉಪಕರಣ ಸೌಲಭ್ಯ ಈ ಶಾಖೆಯಲ್ಲಿ ಅವಲಭ್ಯವಿದೆ. ಕಣ್ಣಿನ ಪೊರೆ ನಾವು ಸಾಮಾನ್ಯವಾಗಿ ಹಾಗೂ ಅತಿ ಹೆಚ್ಚು ಸಂಖ್ಯೆಯಲ್ಲಿ ನಡೆಸುವ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ. ಯಾವುದೇ ಚುಚ್ಚುಮದ್ದಿಲ್ಲದೆ ಯಾವುದೇ ಬ್ಯಾಂಡೇಜ್ ಇಲ್ಲದೆ ಕೇವಲ 5ರಿಂದ 10 ನಿಮಿಷಗಳಲ್ಲಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನು ಲೇಸರ್ ಉಪಯೋಗದಿಂದ ಮಾಡಿ ರೋಗಿಗಳು ಮನೆಗೆ ಹೋಗಬಹುದು. ಇಲ್ಲಿ ಅವೈಲಬಲ್ ಮುಖ್ಯವಾಗಿ ಕರಿಗುಡ್ಡೆ ಹಾಗೂ ಡ್ರೈ ಐಗೆ ಸಂಬಂಧಪಟ್ಟ ಎಲ್ಲ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ಇಲ್ಲಿ ಅವೈಲಭ್ಯವಿದೆ. ಹಾಗೂ ಅದರ ಬಗ್ಗೆ ಹೆಚ್ಚಿನ ಮಾಹಿತಿ ಡಾಕ್ಟರ್ ಸಂಜನಾ ಅವರು ತಿಳಿಸುತ್ತಾರೆ.
Amongst all the Agarwal branches. So just to give a little introduction, we know that the most common symptom of the eyes we see is a dry eye, and every one of us would have experienced this at some point in our life. And especially with the recent times in the pandemic, we do have a lot of work from home opportunities for the IT professionals and a lot of online classes and other online courses for people. So this has increased our use of gadgets, computers, mobile phones, TV, laptop, etc. And most commonly what we see is dry eye. So when we say dry eye, the first thing is it's not just the eyes are very dry all the time. It can be that amount of tears that is what is produced in the eye are sufficient, but still the patient may experience dryness. So patients come to us saying there is irritation, burning sensation or redness, itching, etc. And on examination we see that their eyes are dry. So most commonly you all would have used some sort of eye drops where the eyes are kept moist, and for some time it is beneficial. But again, you may come back with the symptoms saying that I have used enough number of times, but still I don't feel much of a relief. So in such cases, not only eye drops, we also give therapy that we have at Dr. Agarwals, which is called as the dry eye treatment, which is basically called intense pulse light therapy. And this seems to be extremely beneficial to our patients who are not just happy using eye drops multiple times a day. Now, what a younger population or older population can utilize and provides excellent relief for both signs and symptoms to the patients. So, do utilize this opportunity when you have especially the dry eye associated symptoms. So, thank you very much. The use of computers, laptop, etc. Older population, dry eyes can happen. That can be because of some systemic diseases like diabetes, hypothyroid or other vitamin deficiency. Our dry eyes do have an offer where dry eye evaluation free at MRTV along with the doctor consultation till next month mid. So during this time it will be a good opportunity for everybody to utilize the same.
And it's curable?
Dry eye, it depends upon its severity. Suppose mild cases we can cure it, but suppose if it's very severe, we can reduce the symptoms. Complete cure may be possible in some, may not be in some.
Sir, apart from any treatment, of course, treatment comes at the last as a result. So I want to know, is there any preventions for this, or which is the age that, what are the simple symptoms so that we can identify it at the early stage? This is I wanted to, because you know the treatment comes at the last. Before going for the treatment zone, I want to ask you, is there any preventive measures, or what are its normal symptoms that we can, if you approach in that condition, I think we can get a permanent solution for this.
Right. So initial time we have to protect our eyes. So let's say computer gadgets ella jaasti use madbekare. It's a highly specialized technology and which we imported from Germany. So because of this high technology, the cost of investment in the equipment itself is extremely high. So that is the reason, because of its high speciality and high specialized this thing, the treatment is also placed at that price.
Then start working. Sir, one more thing.
So right quantities of fruits and vegetables, all options we have to consume very well. Suppose that it will definitely affect the eyes and also has impact in the form of dry eyes. So that's why we always say green leafy vegetables or different fruits.
Treatment is in the form of sittings. Per sitting it will cost you around 5,000 to 7,000 rupees. 1,20,000 is for refractive smile surgery, which is to remove glasses permanently.